My name is Bruce Wilhelmsen, and I am a native of Kansas City. Went to school in Texas at Southern Methodist University, and from there I attended Duke University for my medical education. After leaving Duke, I went to the University of Virginia, where I trained in orthopedics, and there I met my wife. Trying to stay close to family, we made a decision to stay in this region since her family is retired Navy. When I was at Duke, I took a year of my time to study heart surgery. And after a year of doing heart research, I decided that wasn't for me. I didn't want to do 10 years of heart training upon leaving medical school. So I had the opportunity to work with a great orthopedic surgeon at Duke, Dr. Bannock, who was one of the first people who pioneered microsurgery of fingers and replants. And it was quite inspirational for me. I love the opportunity to work with my hands as well as with my head in terms of what I did in medicine. And there was such a broad spectrum of things you could do surgically in orthopedics that it had a real appeal to me. And from there I chose to go into that field. And perhaps it's because I had so many orthopedic injuries myself as a young aspiring athlete, or maybe a weekend athlete, that this seemed sort of a natural interest that came to me. I like the interaction with the people. It's not just the patients, but actually with all the people we interact with. The patient's experience begins with the first phone call to the practice, and from there up to the time they see you, even to the point they check out, if anything bad happens along the way, they have a bad experience. So it has to be a collective thing that you deliver to people, and I think that administratively being part of the growth of Orthopaedics East, and the merger, growth of the building, the culture of the orthopedic practice here meant a lot to me. So when people come here, they know there's going to be a specific challenge, and they have to be ready for it. And this is the type of person that I've always wanted who will run towards the fire. They're the person who comes towards the challenge. They come towards the need. They're there when patients need them the most, when they're critically ill, when they thought life was great, then some traumatic event happens and their world changes. You want to be the person who responds to that. If you're trying to help someone come to a decision about what they want to do, and they go, well, I don't know, you're the doctor. I am, but it's their body. And I have to make them understand and weigh the risks and weigh the benefits and see how it impacts their life and what they're willing to undertake. And then go down the road with them if they want to go. And if they don't, we're still friends.